Alberta reported 313 confirmed cases of measles Thursday, the highest number seen in the province since the 1980s.
This is a big problem, and it could get out of control quickly.
A group of Alberta doctors going public, warning of the highly contagious and potentially deadly disease. Measles resurfaced in the province about 2 months ago.
Once you get to 1,000 cases, you can expect between 1 and 3 deaths, and in the same vicinity of serious complications like deafness or seizures or problems with mental development.
The health minister acknowledged on Monday that more needs to be done on measles. An advertising campaign urging vaccinations is set to start next week. The president of the Alberta Medical Association applauds that, along with the move to increase access to vaccination clinics. But the NDP is accusing the government of being too slow to respond to an obvious emergency. 19 people have now been hospitalized.
The government waited until we went from a few dozen cases to over 200 cases before they started raising alarms. Now we're over 300 cases and more people requiring hospitalization.
The health minister says they have been ramping up the response as measles went from an issue mostly contained within families to wider community spread.
We're now at 68% increase in immunizations. So we are getting that information out. Of course, we want more people that are unimmunized or underimmunized to make sure that they get out and get their immunizations.
Another reason the doctors chose to speak out to combat online voices who claim vaccines are not safe, despite overwhelming scientific evidence to the contrary.
Disinformation is essentially misinformation put there for a reason, and this is actually a big business. People profit from disinformation campaigns, and they are increasingly prevalent on social media especially.
Alberta has a new measles hotline and webpage, alberta.ca/measles, to keep the public updated and encourage vaccinations. From Edmonton, Sean Amato, City News.